Good afternoon, parents. A very warm welcome to everyone who has joined in from the ParentTune network. That is from the ParentTune app, the site, and the website. My name is Nitin, and I'm the co-founder of ParentTune. Let me today begin the session by telling you a small story. And this is a real story, happened in the last 2 days, and I'm very happy to share that. I think I can share the story many times. So I got this video from a friend who lives in the US. He shared this video and he said, please watch. Of course, I had to watch the video. And this friend had shared this video asking me twice or thrice, did you watch? Did you watch? So I watched the video. And then there was this doctor in this video who was sharing some practical ways to home treat COVID. And it meant that I could keep things ready. It meant preparedness. I found it incredibly helpful, the whole video. We shared the video on ParentTune with credits to the doctor, and the response has been fantastic. I'm sure all of you have seen this video. It is very, very helpful. In case you haven't seen this video, please do go and watch this video on ParentTune. I realized that I had to thank the doctor, and I started looking for her. And I started looking for her on social media at all places. And finally, I did reach out to her. And then once I got to Dr. Sandhya to thank her for the great work she's done, I also realized she's already a global icon. She is helping so many parents. She's all over the New Zealand television. I was like, very sheepishly, I asked Dr. Sandhya and I asked, would you want to do a live with us? And she was so gracious. She came forward and she said, of course, I would love to help parents in India. Dr. Sandhya is today on this live session within just 2 days of me reaching out to her. And I'm extremely, extremely thankful, Dr. Sandhya, for the extreme gracious, attitude which you bring to the whole craft of communication and being a doctor yourself. I'm very, very glad to be hosting Dr. Sandhya on this session. Warm welcome to you, Dr. Sandhya.
Oh, thank you so much, Nitin, for that lovely introduction. The pleasure really is all mine. And I'd like to say kia ora from New Zealand and namaste and hi. Yeah, it's been quite a busy week, quite phenomenal. So I think you hit the nail on the head, though, in your introduction, that my video was basically a practical guide. And you could say it was my form of a disaster management plan. So, I have one sort of motto in life, and that is to prepare for the worst, but hope for the best. And once you've prepared for the worst and you've got your contingency plan, you can get on with life.
Right.
No matter what, is going on and going around. But that contingency plan has to be bulletproof.
I think that's a great point to sort of get started with the whole discussion, Dr. Sandhya. So, in fact, I was about to ask you, and even while we were talking earlier, this entire thing of preparing for the worst and hoping for the best, I think is great. So, if you could talk a little about the whole, first principles of understanding when there are symptoms of COVID and how you know that you have COVID. If we can start from that and then go on to talk about how do you deal with COVID. I think that would be really great to start the session.
Okay, but I actually think we should take a couple of steps back before that.
Sure.
Because before you talk about the symptoms of COVID, you're making an assumption that everybody actually understands what COVID is. And one thing since the beginning of this pandemic, I have been very active on social media, for normally a pretty quiet person on social media. But basically, there was a tsunami of information that came, and all the doctors particularly were basically digesting and taking in this tsunami of information. But the point, the second thing with that tsunami of information was processing it, but then breaking down that information so that you could then apply it in a meaningful way to protect yourself, obviously first, because we were hearing reports that doctors were dying, and that was very scary. and also protect yourself, protect your family, and protect your patients that you're treating. So, so that's where the whole thing started. So in terms of, and the whole thing, which was my attitude to the whole issue, the whole pandemic, is that the only way to win is through knowledge. Okay, because if you people were using this analogy of war quite a lot. This is a war, this is a war, heroes war, very emotive words. But actually, okay, if you want to call it a war, then the coronavirus is the enemy. The actual virus. Now, to defeat an enemy, or to avoid being overwhelmed by that enemy, you need to understand everything, all the weaknesses of that enemy, the nature and the weaknesses. Okay, so until you understand, and again, this is the principle of my video, because actually what I said is not new. It's been published in India Express newspaper just a week before by a specialist. Most of those things everybody knows. But what was different in my video, which I feel has struck a chord, was just as I'm a GP and I understand that when I treat a patient, if I prescribe them a treatment, unless and until I explain to them why they should take that treatment and some basic physiology behind it, they're not going to do it. Right. So that's the principle. So one of the key things to understand about first of all, that COVID-19, which means, coronavirus, which, was first picked up in 2019, was that it's an RNA virus and it has a fatty envelope. Okay, so that fatty envelope is an area which, we need to basically disrupt in order to destroy the virus. And that is why you have this hand washing for 10 seconds. And I was actually trying to think, if I was to make an analogy, if parents, we're addressing parents here, I'm also a mother, I've got two teenage children, but if you've got younger children, for example, and you are trying to get them to understand why you need to wash your hands for 20 seconds, do one simple exercise. Give them an apple, coat that apple with a thin film of oil, and then tell them, go ahead and wash it off. Try and do it with water. They're not going to be able to take it off. You have to use detergent or soap or alcohol to actually remove that oil layer. So it's the same thing. So that is a very basic fact which a lot of people don't understand, and they don't understand that that's why you have to wash your hands, and that's why you shouldn't touch your eyes, your nose, or your mouth unless your hands are clean, unless you can be 100% sure that your hands are clean. Right. So I think that's a very important thing first for everybody to understand, because, everybody assumes that everybody knows the basics, but actually they probably don't. The second thing, which I think is very important to understand, is that why is social distancing important? Because although everybody's afraid of this invisible enemy is only transmitted from person to person. So the reason for the distance and the optimal distance is probably 2 meters, or, the furthest away possible, or then 1 meter, or then if you can't maintain that, obviously a mask, and it depends on the density of the population where you're staying, is because unless you maintain that, if you maintain a distance, if you block the chain of transmission, which is between person A and person B, there is no way that virus can jump from A to B. Right. Okay? Now, one thing which I really, really liked, which was being shared by an Australian doctor early in the pandemic, when everybody was still, it's all been a process of people, getting over what the norms are. The norms are to not tell people to not socialize. But what he said, rather than thinking of social distancing as an act of fear, you have to reframe. And that's another thing that I want, a word that I want you to think about, especially as being parents, is that reframe. That reframing has to be applied pretty much to everything we ever used to do. So the reframe is basically that actually maintaining the distance from the other person is not an act of fear, it is an act of love. Because what you're doing is you're saying, I do not want to infect you.
Right, right.
Okay, and that's also something very important, because a lot of people are struggling with the whole staying away from grandparents and elderly people. Right. And you need to be able to understand that. It doesn't mean that you can't be connected. you just cannot be physically close.
Right.
Because you love them so much that you do not want to make them sick.
Right.
So I just wanted to get those two concepts very clear so that people understand the basics of why there was a lockdown, why are these things, you know.
Thanks, Dr. Sandhya. Thank you so much. And, you know, I also want to just share at that point in time what we were discussing earlier about the whole importance of lockdown, what has happened in countries, the time we locked down, and how it helped in sort of containing the whole spread. And one of the things which makes me, as a preparedness point, start thinking on is essentially now, once someone has, let's say, early symptoms of COVID, even mild symptoms, like you've spoken earlier about, what are the first response or what are the first few things one should be prepared for, or what should we have at a household level to start preparing to deal with COVID?
Okay, so I think you've covered a few things there. I think, first of all, before anybody has any symptoms of COVID, I would want you to go through that list that I did in my video ASAP and get it before anybody's sick. Because, you know, when you're sick, you know, you don't know, one or maybe a few of the family members might get sick. It might be difficult to leave the house. So, you know, you really need to get that list prepared. The second thing which you talked about is symptoms. Now, first you have to actually know what are the symptoms.
Right.
So, I mean, the most common symptoms, and unfortunately, in the age of COVID, you cannot assume that, oh, I've just got a cold. It's just a normal viral illness, because it is so, you know, ubiquitous, basically. And then you have to assume that if you have, you know, a fever or a cough or lethargy, sore throat, runny nose, you know, muscle ache, some people get, you know, tummy ache, diarrhea, headache. And also another point I'd like to make, it's not necessary. I mean, in medicine, one of the things is there's no black and white, okay? There's mainly gray. So even if you say, oh, I've had people say, oh, but my cough is not dry cough. It's just got a little bit of mucus, so it can't be COVID. I mean, that's not true. You know, like it's you know, like you can basically you know, work within that framework that any of the usual upper respiratory tract symptoms or cold symptoms or viral symptoms that you've had before, they could be COVID. Okay, but you know, in order to make any guideline, you've basically got to try and you know, list what are the common things. All right. So in terms of what I was covering in the video, the reason I did this video was because, you know, one of the things that I like to do is whenever I think about things, I always like to put myself in the other person's shoes and think, well, how would I deal with that? So I know I'm very lucky to be living in New Zealand, where, you know, thankfully, because of excellent leadership and the team of 5 million that were cooperating, and, you know, obviously a smaller population, we managed to, you know, pretty much control COVID. So you know, we are lucky, but that doesn't mean that I'm not thinking about, you know, everybody else in the world, and particularly, obviously, my family. I mean, that was first and the foremost reason why I was doing this video. Was this whole time I was just trying to understand how I could protect my own family and give them the best possible chance that they're going to make a full recovery. And so hence, you know, I formulated through my, you know, reading. And that's another point I'd like to make, is that what I find is that, you know, that nobody, I mean, we're all, there's no rule book for the current situation. So what you find is that people complain a lot. They'll say, oh, government did this, government didn't do this, the lockdown didn't work. I mean, you know, that whatever may be the case, there's no right or wrong. You can't turn back time. You don't know what could have happened. But the one thing that you can focus on is that in that time, especially in India or whatever country that did have a lockdown, the knowledge that we gained was huge. You know, I mean, and we're still rapidly gaining that. And that is a massive advantage. And so utilizing that advantage and then making that list, which is based on a good amount of anecdotal evidence as well as early evidence, that's based on what doctors usually like to act on is evidence-based medicine. The problem is, in a pandemic, there's no evidence base. It's all live. It's all happening live.
Would you like to, Dr. Sandhya, also share that list, like if we can go one by one of things which we should have from a preparedness point of view. So let's go one by one. And
okay, well,
yeah, that's really useful.
Okay, well, I think the top of the list, and I didn't spend that much time on the video because I knew I needed to get to the demonstration bit. But actually, I want to stress that the top of the list in preparedness is your investment in your own immunity. Okay, because that is the number one defense for any infection. And it is very important that you are, I think there's two concepts there. One is priming your immunity, is what I was talking about in terms of it should be at its prime. And the second one was boosting, is what I talked about, the multivitamins. So I'll get into that. But in terms of priming your immunity, I can summarize it very easily into 5 concepts. And that is you need to eat well. And when I say eat well, I mean you have to eat real food. I tell my patients, you need to eat food like God made it, not coming out of a packet, not coming out of a box. So it should be, like your vegetables, your fruit in many colors because they contain antioxidants, your lentils, your proteins, the real food, not the junk food. Okay, and so that real, because it's those processed foods, they also, that's wasted, that's not doing anything for your immunity, basically. So number 1 is eat well. The other one is sleep well. Sleep is crucial. And I know, particularly in some countries that have had prolonged lockdowns, it's very difficult to have a regular routine, and also for children. But it is very important that you are getting, 7 to 9 hours of sleep a night, because it's very important for your immunity. Now, so that's eat well, sleep well. The other one is that you need to move more. You need to do exercise. And the fourth one is that you need to love more. And that love more means that you have to still remain connected to your circle, because that's very essential for your immunity. Loneliness is bad for your immunity. Now, the sum total of eating well, sleeping well, moving more, and loving more will mean, number 5, the most important, that you are stressing less, because you must remain calm. Because when you are stressed, basically what happens is your body is in a constant state of fight or flight. And that is very bad for your immunity. On a physiological level, it's very bad for your immunity. And what I would say is that you need to reserve that fighting spirit for when you actually get infected. So that's, that's the immunity. In terms of the list of the immune boosting, a lot of people on the YouTube link and various places are asking me about the vitamin C, the vitamin D, and the zinc. Now, there is good evidence behind these 3 things, and they are being used commonly. There are studies for the vitamin D in particular that showed that in patients that had higher morbidity with COVID had low levels of vitamin D. The second reason why you have to stress vitamin D is, in a prolonged lockdown, you are not getting your regular, exposure to sunlight, and darker skin obviously takes longer to absorb enough sunlight to make enough vitamin D. So people are, trying to get me to say, exactly how much. I did see that there is a UK study where but they came out and they said that all adults need to be taking 400 international units of vitamin D a day. The other thing is with vitamin C, people were asking about the dose. It doesn't really matter about the brand or the dose. You could look at something like 500 milligrams, and the same with zinc. It doesn't really matter. You can get a multivitamin. You've just got to use your common sense. It's some is better than none.
Right.
And everybody will have a different, underlying medical condition, depending on their age. Like you can't give a child the same as you're giving an adult, for example. So it's up to you. I'm just providing a guideline, but it's up to you with any of the advice I've provided does not mean that you should not be getting your own medical advice. I would highly advise you to get your own personalized medical advice from your own treating physician. This was purely as a guide, and also because I am very acutely aware that there will be people in a situation where they may not be able to access any medical care. And for that reason, I was trying to give them something at least that they could fall back on, because everybody deserves to have a fighting chance.
Right. So on that note, there's one question. The first question, Dr. Sandhya, on the live session. So I already am receiving like almost 13, 40 questions have come in already. And while we are, what we'll do is we'll also keep taking these questions in between. So the first, how much of vitamin C, vitamin D, and zinc per day is required for an adult and for a child? Like, is it the same?
Again, I don't know those figures off the top of my head. I did read today, because I know a lot of people have been asking, that in the UK they're recommending that adults take 400 international units a day. But these charts are readily available depending on the age group online. So, but also it would depend on, what other medications you're on. You have to make sure that you're not doubling up on supplements. So again, I was talking from, from a general point of view. You don't necessarily have to be taking these multivitamins every day. In the video, I said at the first sign of symptoms, you must start taking an immune boosting supplement, and definitely vitamin D, vitamin C, and zinc have to be taken. So it doesn't exactly matter how much, but it can't be none. Okay. Is what I'm saying. Okay? Because again, the science here is still not perfect, but we know that you need to have some. So that's the point. It's a guideline.
Got it. So Sandeep Kothari had asked this question from Bombay. Sandeep, I hope you got an answer. So also our recommendation would be to talk to the doctor, and also just make sure that, like Dr. Sandhya has mentioned, if you are on any other medication or if you're on any other supplements, you're not doubling down on them. It would be better that you also take your doctor's advice on this. Also, Dr. Sandhya, we discussed about, preparedness. So in terms of preparedness, what are some of the other key points you would like to highlight?
Okay, so the second point I went through, so the first point we've covered is the immunity, which is number one by far. And the other thing I would actually just want to quickly go back with the immunity is that it's not only, the reason to invest in your immunity is not only to give you the best, to make sure that your immune system fights off the infection. It's also that there is this concept where, because this is a new infection, all we're hearing at the moment is about, the number of people that are infected, the number that have recovered, or the number that have actually succumbed to the infection. But what we're not hearing as yet, and the stories are, coming out now, is what they call the sting in the tail of the infection. And so these are the people that keep on getting symptoms, later. So my theory is, and again, it's a common sense theory, is that you basically need to, sorry, I just lost my train of thought.
You were saying about the whole new...
Oh, yeah. Basically, you need to try and give yourself the best chance of a good long-term recovery. Right. That's why you basically need to.
Right.
Yeah. Okay.
Okay, great. So in terms of what you were talking about, preparedness, and I think what's been really great is, and everyone is like really looking forward to understanding from you on what are, 2-3 top key points that if suppose, someone gets COVID, now how do I go about it at home? And just to give you an idea, Dr. Sandhya, there are hospitals which are in red zones in the country. In India, we are now having red zones, orange zones, and green zones. So the red zones are now, the hospitals are also quite packed in some of the locations in India and some of the cities in India. And a lot of home treatment is being prescribed, right? And the doctors are also requesting for mild cases of COVID to, self-quarantine and start treating yourself with their advice at home.
Right. Yeah.
So if you could
So
get...
what do you choose to do?
Yes.
So exactly. So I mean, as soon as somebody in your family you suspect has come down with symptoms, then straight away you need to get some medical advice.
Right.
And it would be preferable if you could get tested. That person needs to be isolated on their own straight away within the house. So they need to be put in a room on their own. You can, give them an iPad with some Netflix, but they're going to be pretty much on their own for the duration of at least 14 days of the illness, if not longer. It would be preferable if they had their own bathroom. You're going to have to be, the other family members, you're going to have to be very careful about interactions with other family members. So one of the ways, again, in terms of basically protecting the rest of the family is making sure that during any interaction that the one that has the symptoms is wearing a mask at all times, that they're given separate cutlery, and preferably even disposable cutlery, and it is, their food is given to them on a tray, and it's very carefully, handled and disinfected, such that you try and avoid any of the other family members also getting sick.
Right. No, that is very, very effective, basic understanding of someone who is getting isolated, Dr. Sandhya. But what after that? Now, say for example, someone gets COVID and wants to start home treatment and start recovering from it. And I remember speaking to you and listening to the important aspect of respiration and breathing.
Yes. Okay. Yeah. So that's again the two things is that there was the importance of reduction in viral load in terms of a principle of management, and the second one was breathing and positioning.
Right.
Okay. So in terms of what we do know with the infection basically is that it enters through your nose and your mouth. And then just like any other virus, generally it causes an upper respiratory tract infection. So usually the first sign of getting symptoms is your, warning that, oh my God, this virus is in my nose and mouth. And I need to try and dilute that viral load. Okay. I need to try by boosting my immunity and by diluting the viral load through all the nasal things I went through. You are going to try your hardest to halt the replication in the upper respiratory tract before it goes down into the chest. So that's why I suggested using various things like, your saline nasal spray, betadine. You can do saltwater, gargles twice a day. Again, the betadine, they were using it quite early on. They recommended it to doctors as a form of prophylaxis when they were coming and going from work to just, do some betadine gargling, because again, it's an antiseptic and you're trying to, kill whatever, virus particles may have come in through your upper respiratory tract. So the same principle basically, but some people might find the betadine a little bit irritating. I think in India, the formulation has a bit of alcohol and mint in it, and it can be irritating. So, there's no point making yourself feel more miserable. You can just use salt water, or even there's some antiseptic dental washes, even like Savicol. Again, it's theoretically it's going to help. Right. And the nasal rinsing, same. It's simple to make up a saline solution, like I showed that sort of squeezy bottle you can get, and you just need to put half a teaspoon of bicarb soda and half a teaspoon of salt. You don't have to put any betadine in it. The betadine, a lot of people asked, in New Zealand, and I think in India as well, the betadine throat gargle comes either in a concentrate or it comes in a ready diluted form. Yes. So if you were to use the concentrate, you have to put it in the little, jar and add water. But this is a good formulation. It's a throat gargle. It's the sore throat gargle betadine. You can just put a few drops in the, saline of the nose, or to just give that little bit of a boost. Again, Again, and the same with the steam inhalation. Most of it is just common sense. I mean, if you're losing your sense of smell or if you're congested in your nose, the steam is actually going to make you feel better. And I suppose the theory with Vicks is it's a little bit of a noxious smell. So if you've lost your sense of smell, then perhaps it will actually just, it could help get that back. Another thing which I didn't mention in the video, which is also very important, is something like an Otrivin nasal spray. And that's very, very important to get nasal decongestants because, again, the nose not only runs forward, it also runs back and causes a tickle in your throat. And that can be one of the most common causes of cough. So if you can, the sooner you dry up the nose, that is, preferable, because that will be another way in which you can try and prevent the infection going down into your chest.
And is this
so
like a saline spray? Sorry, Dr. Sandhya. Is this like a saline spray? Any saline spray works?
Any saline spray works.
Right. So
they're
and in India, this actually can be got over the counter. So we can go and...
In India, you can get any medicine over the counter. That's why everybody in India is a doctor.
I won't say much on that, but I think this bit on the saline spray is a great input, Dr. Sandhya. And go on. You were saying, so first thing is...
Okay, so first was the diluting the viral load.
Right.
Now the second thing was breathing.
Right.
Breathing is really important. I think what everybody really liked my sponge.
Yes.
Analogy.
Yeah.
And again, it's very important to actually understand and to be able to visualize, because breathing is actually difficult. We think we do it every day, but actually we most of us don't breathe well. We breathe very shallow. And that's why for the form of exercise, yoga is excellent, because it's getting your body moving, plus you're concentrating on breathing. And what I really liked about this analogy is because basically that, I'll just tell everybody again in case anybody missed it.
Yeah.
So basically, so this one I used as an analogy for our lungs, because it's just like, like the little airways that we have. Except it's shaped a bit more like this, and you've got one on either side. But what people don't realize is that most of the airways are actually situated at the back. When the doctor examines your lungs, they're listening from the back. They're not listening from the front. Okay. So in terms of breathing well, it's very important that you focus on the breathing out phase of breathing. Okay. You actively focus on the exhalation. And so I sort of, and because if you clear out all that old air that may contain carbon dioxide, you are emptying your lungs so much that the inhale anyway is a reflex. You will deeply inhale once you have emptied your lungs fully. Right. And when you deeply inhale, you will be getting as much oxygen as possible.
Right.
So that's what I was just sort of showing. So this is the sort of thing that's going to happen. You're going to breathe out and you're just going to be emptying your lungs, and it'll be looking something like this. You'll be going. And see how even the sponge just pops up.
Right.
It just almost reflexly, once you've emptied it. Same if the air was water, the maximum water that you're going to get in is if you empty this sponge as much as possible.
Right.
So that was a very important, because you have to think of something when you're breathing. You can't just, like you have to actually visualize what you're doing.
Exhaling, and then Dr. Sandhya, in terms of exhaling, when we are exhaling, did you also could you tell us, should we stop, like when, say for example, when I exhale?
So, yeah, it's good to stop. No, so breathe all the way out, then hold it, then breathe all the way in and hold it. So I went through this method, and this is very good for your stress levels. It's a very good exercise to do now while you're well. And it's something called box breathing, where basically you imagine you're drawing a box. And so you can use any timings. You can start off with 3 seconds, and then you can, as your breathing gets better, you can extend it to 5 seconds, or, whatever. So basically you start with breathing out, and you're drawing a line across. So you're doing,
Right.
Hold. Hold. So the hold is the lines down. Okay, so again, it's using, like an image to help you do that breathing.
That's
And
fantastic. I love that. I love that,
yeah,
Dr.
and that's a basic treatment for anxiety. Okay,
Right.
because another very important thing that people don't understand is that anxiety, all the symptoms of anxiety, which everybody is probably suffering at the moment during the lockdown and the pandemic,
Right.
is caused by hyperventilation and a change in the gas balance
Right.
between your oxygen and carbon dioxide. So the basics of treating anxiety is your slow breathing.
Right.
So it's very important for your stress levels too. Now, what I was talking about in terms of the other exercises, which is very important, is that when the worst thing that seems to be happening, I mean, there's many things that this infection, this virus, can cause havoc in all systems of the body.
Right.
So we're talking about mild coronavirus, and we're trying to talk about what the point I was making is that if you get sick, you need to actively start fighting it. It's not just that like normal, we'll just go to bed and wait for it to go away. No, you need to actually actively fight the infection. You have to throw your everything at it.
Right.
At that, and give yourself the best possible chance. So that's why it was all the, working on the immune boosting, the diluting, and then the breathing. So the breathing, the forced exhalation, what that does, so the balloon exercise, which I showed, and even the blowing bubbles, it's actually pranayama. All these things.
Let's do one on blowing bubbles.
Blowing bubbles, not the blowing balloon.
Yes.
Okay, so the blowing bubbles, for example. So the blowing balloon is actually a very good one. My classmate, who's a hematologist, her mother is an anaesthetist in Malaysia. And when I was talking to them about the exhalation thing, she said, "Oh yes, my mother tells people to do this auto self ventilation using the balloon," and I thought that was fantastic. But then somebody pointed out on some of the feedback on my video that some of the balloons in India contain powder, and
Yeah.
I mean they don't in New Zealand, and I wouldn't want you inhaling powder, definitely not.
Yeah.
In hospitals, they use something called incentive spirometry, where you have this thing you blow and there's 3 balls.
Yeah.
So it's the same thing. You have to blow out hard enough. And pranayama, again, in yoga, they have the same.
Right.
So you don't necessarily have to do those things. It's the concept. But you can pretend you're blowing a balloon. It's still going to do the same. But again, it's that imagery. You have to be able to understand that you're doing something, otherwise you won't. Because actually, it's hard work to blow up a balloon. The same thing is the blowing the bubbles. It's much gentler, but again, it does provide resistance. If you actually try it yourself, it looks easy, but it's not. I mean, it's not as easy as it looks, basically. So we'll just do one quickly. I mean, I could keep on going, but you know what I mean? I wouldn't do it. I wouldn't keep on going if I wasn't blowing into water.
Right.
If I was just blowing, I wouldn't be exhaling that long because it's the incentive.
Right.
That's the only difference. It's just giving yourself something to do, like an incentive.
Yeah, this is fantastic, Dr. Sandhya. We've covered some very important aspects till now, and I'm just taking 2 questions related to that. So the first one is from Mr. Ramesh Agrawal, and he has a real young child right now. He's just 17 days old, and he's just
congratulations.
Congratulations, Ramesh. So, he's asked that could he be doing, although there's, fortunately, there's no one in his family who has COVID, no symptoms, but he's saying, could he do these preventative measures like breathing exercises even before or anything like that?
Oh, absolutely. Absolutely, 100%. I mean, even if you've got asthma or even if you don't, I mean, this is going to improve your breathing. I mean, in fact, I told all my cousins in Delhi, I want to see their video with their balloon blowing and their saturation at 100%. I want to see it because why should you start a new trick when you're sick?
Right.
You should You should practice these things when you're well. That's exactly what my point about immunity. You shouldn't wait till you're sick before you start working on your immune system. You should work on your immune system when you're well.
Right. And the next question, Dr. Sandhya, is from Samir, who's asked this from Gurgaon. He's asked that they've traveled to their hometown with their family, and now we are all in institutional isolation. Please suggest precautions which I should take or we all should take as a family.
Just being in isolation?
Yes.
Well, I suppose the main precaution of being in isolation has mean he's in lockdown.
He is actually traveled from one place to another, and now because they have reached there, there are.
It's like a compulsory quarantine.
Yes, correct.
But then nobody's sick.
Nobody's sick.
Okay. So I mean, again, the same things, you know, like just because you're in quarantine doesn't mean you stop living.
Right.
You know, one thing which we have to realize, and I mean, this is a parenting channel, and you know, as a parent, it's a conversation I've had with both of my children as well. And you get this, and everybody's, I mean, everybody's in a big grieving process. You know, that we've lost our normal way of life. Now, and everybody's like, why now? Why us? Particularly the kids. And again, I want to bring back that point of reframing. What I said to my children was that, well, I mean, we're very lucky. I mean, our generation has been very lucky that we've managed to grow up without any major events. But if you look at our grandparents' generation, they went through one event after the other. You know, whether it was a war, or whether it was the Depression, or whether it was the Spanish flu, there were a lot of, you know, there were a lot of times where this, you know, things have happened. It just hasn't happened for a long time. Now, actually, at this time, because of technology, we were placed so well that, you know, our children could study, you know, from home. You know, people could work from home. You know, we could remain connected via video calls. I mean, you know, 10, 15 years ago, we wouldn't have been able to do that. So rather than focusing on the negatives and, oh my God, I cannot leave the house. Yes, it is difficult, but you need to reframe your thoughts and you need to focus on the positives. Right. I mean, and even if you've lost, you know, your career or your job, I would encourage you to start thinking in a very creative way. I mean, society has to repurpose itself for a while, but it's only going to be temporary. I mean, this too shall pass. And so, you know, I mean, there's lots of examples in different countries where, you know, for example, you know, doctors were busy, or you know, or medical students were, you know, not were just, you know, they couldn't really help, but then they were turned into babysitters for the doctor's children once they were, you know, vetted. So again, it's, you know, or you know, student volunteer armies were going and doing grocery shopping for the elderly. So we all have to get through this together somehow. Right. And you know, and it's very important that you give that positive. I mean, that as parents, that we have to be able to reframe it for our children so that they are able to come out of this stronger, because you know, everything happens for a reason. And everybody's basically, you know, was worried about lots of different things going on in the planet. And this is perhaps a reboot for the planet. It's a time to rethink. Another thing I would like to, you know, I thought I had was in our parents' generation, in my parents' generation, the most valued trait was probably IQ, intelligence. In our generation, it started shifting to EQ, emotional, you know, your ability with your emotional quotient. Now, the number one criteria for, you know, employers is CQ. It's creativity and collaboration. So rather than, you know, like say you're in quarantine and the children are supposed to be doing online school, and, you know, typical parent, you're like, oh, why, you know, why aren't you concentrating? Why aren't you doing that? You know, it's okay to, you know, lay off a little bit and allow them a little bit more creative time. I think a lot of the big companies now, they even have Lego rooms and things like that, because you want to enhance that child's creativity, because ultimately in that new world, this next generation is the one that's going to come with the solutions.
That's very interesting, and thanks for sharing that. I'm going to take another question from Ashish Anand. Ashish is a pro parent on Parentune. He is a regular on our live sessions. Yeah. And he lives in Lucknow, in UP.
Lovely.
So you have a UP Connect, right, Dr. Sandhya? So
yeah.
asking from Lucknow, he's asked that what are the correct procedures, or if you can advise me on how to wash vegetables purchased from the markets and sealed pack items that we bring from outside. We heard that washing vegetables and any other items like baking powder and hot water with when they wash it with them is better, and some people are also using vinegar. So and then keeping it away for 24 to 48 hours will help in avoiding the or keeping the virus away. Is that right? And what would you advise?
Okay, well, yeah, I just had this question on my Instagram as well. But firstly, I'd like to say that actually initially there was quite a lot of talk on strict guidelines about surface transmission and this whole thing about your groceries. And yes, the virus can survive on various surfaces for up to a week. And so it's very important that you manage those groceries properly. But it's also very important to actually realize that in terms of the people that are getting infected, they're much less likely to be getting infected from a surface transmission, unless they're obviously staying with somebody that's infected, than they are from that person's infected respiratory droplets. So yes, you do have to use precautions, but you don't have to become totally, so wrapped up in it. So as a broad and an easy guide to follow is, if you were to get any non-perishable items that don't have to be put away, it's best, if they're in, boxes or plastic containers or whatever, to just keep them aside. Keep them aside somewhere, have a designated place in the house where you get the groceries and you leave them there, whether it be for 3 days or 5 days. Anything that you need to use immediately that's going to be stored in the fridge, that you need to clean that. Now, in terms of cleaning, I do have a video on my YouTube where I actually made up cleaning solutions into spray bottles, such as this. And that's because, well, one, it's actually good for the environment, and it's actually a much easier way to manage than using wipes, and you can't wash everything with
How do you make this, Dr. Sandhya? I mean, how do you go about, can you give a guideline on that, making the spray?
There's, I've got a whole 6-minute YouTube video on it. You can look that up in detail, but in that one, I think in India, one of the best ones that you can have, but I'm not sure how well available it is 70% isopropyl alcohol.
Yes.
And that's a wonderful, if you get it, and you just put it in a spray bottle, it's fantastic, because you can spray that. And the other thing is, people, when you spray something, whether it's a surface, that cleaning agent actually has to sit on that surface for 10 seconds before wiping it off to kill the virus.
Right.
Okay. So that's another reason why it's better to have it in a spray bottle and then have it in a wipe.
Is this similar to sanitizing spray which are being used to sanitize a surface? Is it similar to that, Dr. Sandhya, or is it?
Well, I think I think one of the common ones is bleach or sodium hypochlorite solution. And I think in India as well as New Zealand, the concentration of sodium hypochlorite is 4% in that shop bleach. But in order to make it up into a disinfectant solution, you need 25 mils, which is 5 teaspoons of that 4% sodium hypochlorite or household bleach solution in 1 liter of water. So you get this. So you get this sort of bottle that has labeled to 1 liter, right, and you put 5 teaspoons of that bleach solution in, and then you can spray, surfaces with that. So that would be one. The other one, which I've covered in the video, is, Dettol. That's usually 2 capfuls in 1 liter. Right. And here, I don't know if in India you get methylated spirits.
Yes.
You get methylated spirits. This is actually a methylated spirits. Methylated spirits is very good, but it's 95% alcohol. So the way I made this one up is that I filled it up to 700 mils with pure methylated spirits, and then I put in 300 mils of water, and that basically dilutes it down to an approximately 70% alcohol concentration. Right. So then you can use that to clean, even say, your shoes. It's a great one to, because to spray on the base of your shoes, or, any of the items that, because the isopropyl alcohol you can use on more valuable items like, your phone and things like that. Or you can also, you can get alcohol wipes. But so getting back to the groceries, the vegetables, Look, again, what I had been doing was just basically getting my fruit and veg and filling my sink with some water and putting a little bit of dishwashing detergent and just giving them a bit of a wash in that, then rinsing them well, drying them and putting them away. It seems annoying, but actually it's very economical because this actually improves the longevity of whatever you've bought, and it actually improves the quality of it as well.
Right.
So it's actually quite a good exercise. So your perishable items, yes. In terms of the baking soda and vinegar, they don't actually kill the coronavirus.
Right. So there's the next question from Ashwini Bhatia, who's got a grown-up. He's got a teen at home, and he's asked that his office is opening from the 1st of July back in India, and he's scared to attend as it is very difficult to maintain social distancing and other precautions in the office. And he has a son at home, so naturally he's really worried. He's saying, what are the kind of precautions I can take to keep my family safe once I'm back from office?
Okay, so it's very important when he's at office that he's wearing a mask, okay? Mask, and if possible, glasses. And this goes back to the viral load issue. And this is the reasoning behind masks. I mean, there was situations, I think, where people who are infected, went and took a flight, but didn't manage to infect anybody else just because they were wearing a mask. So if you can't maintain a social distance, a mask, and just a cloth mask, now that mask, when you put it on or take it off, your hands have to be clean. This is something very important. A lot of people are not wearing masks properly. So I just wanted to demonstrate. This is just a cloth mask. In fact, I got a friend to make this one for me, and she just put a little bit of a pocket there so I could put a paper towel or a tissue as an extra sort of filtration layer, because when the masks become moist, they can, become a little bit uncomfortable and less effective. So that's one thing that you can do, but generally speaking, it's fine. Just a cloth mask, even a scarf folded up, and it has to cover the nose and the mouth and go over the ears, okay? And basically, even if you have glasses that you can wear, you are protecting yourself quite well from if somebody that you're talking to, you've covered your eyes, you've covered your nose, you've covered your mouth. Yes. Now, the important thing is when you're going to take it off, first of all, your hands have to be clean, okay? So, you're going to remove your glasses very carefully. And when you take your mask off, because you've got to assume that anything on the external might have COVID on it, okay? So you've got to clean your hands with, soap and water or alcohol, your sanitizer, and then you have to carefully take it off your ears and remove it.
Right.
Okay? So it's very important because you don't want to, infect yourself that way. So at work, he's going to be wearing his mask. When he comes home, particularly, and then this is what doctors were doing. I mean, obviously, because you're working in a high-risk environment, we would basically have a designated station. I would just wear the 1 or 2 pairs of shoes that I would keep out of the house or out to the side or in the garage, and remove the clothing that you've been wearing. Don't shake it too much, and just hot wash those clothes. Have a shower. Wash your hair, and then you can meet your son. And that way, you can feel that you've done as much as you can.
Right.
But again, yeah, I mean.
Thanks for demonstrating that, Dr. Sandhya. I also just wanted to ask you if the glasses need to be of certain types, or we can wear like a power glass, which I'm wearing.
It doesn't matter. I mean, it's just like it could be a sunglasses, it could be any. It's just that, again, it's layers of protection.
Right.
You've seen that the doctors wear the visors and all sorts of things. So there was a lovely a diagram that was done, from one of the magazines, that basically showed, if one person, obviously the best thing is staying at home and not interacting. Right? So short of not staying at home and not interacting, then is a 2-meter distance is better, because your respiratory droplet's going to fall. You're hopefully going to be out of that, fallout. Of course, in India, that's going to be difficult. If not 2 meters, 1 meter. Okay, if 1 meter, then, definitely mask, because again, And then glasses, because again, you know, that's another avenue where, and I mean, it'll prevent you from touching your eyes, and you know, hopefully you won't be getting respiratory droplets. It's not as you know, as significant as the nose and the mouth, obviously, but again, it's a simple thing that you can do. That's
right,
all.
right. Also, Dr. Sandhya, we are towards the latter part of the session, so I'm
Sure.
just reminding everyone who's joined us in the session. I'm with one of my favorite GPs of all time, Dr. Sandhya, and she's joined us from Auckland, and she's today helping us in terms of being prepared and being COVID ready. And in case we get the virus, how do we go about home treatment, be it for mild symptoms or even if we are quarantined and at home? How do we go about it? And we are taking questions right now. Just before I take the next question, Dr. Sandhya, I would request you to also share a little about with your props, because I think you're doing a wonderful job with the props and it helps us understand it that much better. If you can tell us about the whole thing of if someone contracts the virus and is at home, you've already talked about the respiration techniques, but if you can also talk about the aspect of how do we sleep,
Okay. Yeah.
to lie down, that would be great.
Okay. So for that, I need to bring back my rather popular assistant, Rani. She's feeling quite cool these days, but actually I have to correct on the video. I said that this is my doll. My daughter was very upset with me. She said, "Mummy, it's my doll," and I said, "Yes, that is actually your doll."
Rani, welcome to the live session on Parentune. Yes, Dr. Sandhya, over to you.
Okay. So this was another reason why I explained about the lungs being at the back, and this is something that is definitely known and they're using in patients, is that if you want to allow your lungs to inflate completely, it is better when you're sick that you sleep prone or on your stomach. Now, unfortunately, Rani's head doesn't move, but obviously you're not going to sleep with your face planted down. You're going to put your head to the side. Somebody's asked me that question. That's why I'm answering that. And you know, the reason I showed with the pillow, normally the pillow you sleep like this, it would be very uncomfortable on your neck, but actually if you sleep with it under your chest, and it's actually quite comfortable. And
Right.
what that means is that, you know, you can see basically that the lungs can expand properly.
Right.
Because even if you sleep on your side when you're sick and you've got in, you know, some in, you know, fluid or anything, even that side lung is going to get compressed.
Right.
Okay, and that's why they've been doing it in hospitals. You know, so prolonged back sleeping, and one of the symptoms in COVID can be you know, lethargy and weakness, and obviously you're going to be taking naps. So I would suggest that you you know, try and change your position. I mean, you can sleep on your back for a short period of time, but not for prolonged periods of time. And it'd be good to do some gentle stretching, yoga poses. Child's pose is a great one. You know, because you're basically the same thing. You're lying, you know, on your front, and it's a very comfortable position. And you can do some breathing exercises. You can, you know, blow bubbles to your heart's content, and it will help definitely.
Thank you, Dr. Sandhya. That was really important. Also, just want to remind all the parents on Parentune that, I mean, some of the key things which Dr. Sandhya has spoken about, they're all in this video. So in case you've joined us in between, I would strongly recommend that you watch the whole video from Dr. Sandhya. In this session, we still have some time to go. And I also want to remind that tomorrow on Yoga Day, we are doing a live yoga session on Parentune with Pooja Kapoor. And I think in wake of COVID and all the things which Dr. Sandhya has also highlighted, it makes a lot of sense to pick a habit of doing daily yoga. So do join us in that session tomorrow, and children can also join in that session. Now, the next question is coming in from Shalini from Gurgaon, and she's asked that she's had a headache, body pain, and off and on she feels cough and cold. And in all likelihood, this is happening because of seasonal change. She doesn't have any fever and she is active. But this has been happening since last 8 to 10 days. She's also following all social distancing norms. She has a maid coming home and she cooks, but she's limited to only the kitchen area, and Shalini and her family are away from the kitchen area. So they and the maid is using fresh mask every day, and these are like 5 to 6 cases now in her complex. So that is what is sort of worrying her. Does she need to worry because this is all the symptoms and she's decently active? She doesn't have any fever.
Yeah, well, unfortunately, in fact, recently they did a little study on the cases that were in Australia, and that was posted that there wasn't an insignificant proportion that had no fever despite having tested positive for coronavirus, and understanding that a large proportion are asymptomatic. So, as I said before, if you have any upper respiratory tract symptoms such as runny nose, sore throat, cough and things like that, you do have to assume it's COVID. I mean, I know that there's a difficulty in accessing testing in India at the moment, so I understand that it's a very difficult situation. Yes, there are other conditions like hay fever, seasonal allergies which can cause it, and so I would I would recommend that it would be good to, consult with her doctor and make sure that, that's being managed properly, whether it's with antihistamines or whatever nasal sprays that she's meant to be taking. But, and if she's feeling healthy, then that's a good thing. She's doing all the right things. I mean, there's nothing else you can really do. I think the adequate precaution would be to stay isolated until you were feeling 100%.
Right, right. The next question is from RP Shetty, and I think she's asked a question which we've answered before. She's asked it for children especially. She said that can we give vitamin D and vitamin C supplements to children between the age of 3 to 12 years if advised by her doctor?
Yes, you can. Yes, you can. They do come in children formulations, definitely. Even in little babies, sometimes we prescribe vitamin D if the mother is deficient. So that's definitely something that, and children are also not going out in the sun and playing. So it's very important that you do look into that you do protect the children, but also being reassured that children, even if they do get the infection, generally do recover. But that doesn't mean that the child shouldn't be in the peak health.
Right. So, Dr. Sandhya, we've got still questions coming, but I think in the best interest of getting everyone hear from you, the key points from what we've discussed today, if you can take the next 3 to 5 minutes to just summarize some of the key suggestions you would want to give, assuming that someone has COVID, to home treat and to go about it.
Okay. One of the things which, yeah, sure. So one of the things which we didn't cover was one of the most important things, which was the pulse oximetry.
Yes.
Now, one thing I didn't point out in the video, and there are some phone models in India. I think it's Samsung flagship phones is one that I'm aware of. I think they've got an S series, and some of them have their own inbuilt saturation probe. So before you go out and buy one, make sure that your phone doesn't have one. I know the iPhone doesn't have one. Basically, this is very important, okay, because in the context of limited access to hospital care, this is the only way which you can check on your family member who's potentially got COVID. Again, you may not have tested them. They may not have had access to the test, so you don't know whether they've actually got it or not, but you're pretty sure that they do. Is that you need to maintain an eye on their oxygen saturations. And that oxygen saturation, and I'll just demonstrate how you use it. These are relatively affordable and easily available in the market. They just come with some batteries that you put in the back, and then basically you just slot your index finger into it. And I did have a cousin call me with a SATS of 84, and I was quite worried, and she was very healthy, but she just didn't put her finger in far enough. So please make sure you use the equipment properly. The finger has to go all the way in, okay? Oh, now it's turned off. And all it's doing is it's shining a light and measuring the level of oxygen saturation.
Let's see yours.
Let's see mine. Have I given out enough air at the moment talking?
It is showing a reading. So I think it's 66 or
upside down.
Upside down, sorry. Are you saying it's 99?
It's 99.
Wow. Is that good? That's great, right?
It's 100 now. Yep. After the balloon blowing, it was 100.
Wow.
On the video.
Right.
Interestingly, at the beginning of the video, my oxygen saturation was 100, and then I said my oxygen saturation improved. But actually, what you don't know is that I practiced blowing a balloon before I recorded the video, and that's why my saturation was 100 at the beginning of the video. But it wasn't 100 before I blew that balloon. It was like 99 or 98.
And what's a good reading, Dr. Sandhya?
So, I mean, normal is between 95 and 100. And in the video, I talked about, getting a bit worried if it's below 93, particularly if you are starting to get shortness of breath or, any breathing difficulties. But again, that would depend on, whether you have an underlying respiratory condition. I mean, definitely under 90 would be a big no-no. But the 93 level, I mean, definitely you would be actively doing your exercises and making sure that you've got in touch with your doctor. And that's another point, is that a few people have asked about oxygen cylinders and stuff. In the context of a inaccessible health system, due diligence would be basically making sure that you've got a plan for a home. I think in India they're launching home care plans.
Yes.
Or home ICU, or whether it's an oxygen cylinder. So it would be very worthwhile just doing that research and having that plan ready to go. And I think if you did all of those things, like I said, number one, you tried not to get the infection. If we're talking about a summary, number one, back where I started, understand how the infection is transmitted and how you can avoid getting that, and avoid it at all costs. Okay. And number two is preparing that if you do get it, that your immune system is primed, that when you do get it, you start boosting it straight away with your vitamin D, your zinc, and your vitamin C. Also, again, the medical advice is very essential right at the beginning, because I know in India and in a lot of countries, there are simple antibiotic regimens that doctors are prescribing. And they are only effective, they're most effective if they're taken early. So there's no point talking to the doctor 10 days into the illness. It's better to get advice, even if it's a virtual advice, even if it's on a telephone. And it is available in India. They do have virtual, advice, and it's very important to get that advice at the outset. Right. Regardless of whether you've had a test or not, you pretty much have to assume that you've got it. And that everybody else has COVID. That's how you've got to behave. Everybody's got COVID. I've got to treat everybody as if they've got COVID. Obviously, not in your house, but if somebody's infected, but outside interacting, you have to think that way. So actually, that's the other concept which I sort of thought of, is that to treat COVID-19, you need to have 20/20 vision. And 20/20 vision means that you have to, rather than living in ignorance and fear, you have to live with knowledge and, with determination.
Right.
Knowledge and determination. So, and actually it's, this whole plan, this, it's like in any civil emergency, you need your disaster management plan. All I'm providing is a basic disaster management plan that, should the worst happen, this is what I can fall back on. And if I have that, and just having that plan is enough to boost your immunity.
Right.
Because if you know what you're going to do, your tension level is going to go down, your immunity is going to go up.
Thank you for that. Thank you so much. I think this session has been not only wonderful, but one of the things which I want to highlight for everyone who's been with us on this session from Parentune. I've interacted with Dr. Sandhya in the last 2.5, 3 days, and what I admire about you, Dr. Sandhya, the most is your compassion for helping people, and the way you're going about it, and the way you not only help people back in your country, which is New Zealand, but you've gone ahead and helped people across the world. And I'm really grateful for you to have come forward and accepted our invite graciously to do this live session with us. I'm hoping we can do more, and I'm hoping that because it's so much fun doing a live session with you, you make it so interactive. And I've personally been you're my favorite GP, and I'm officially saying this live. You've been a great, expert today on this live session. I would want to thank you from all of us on ParentTune who have taken us through the way you have, and definitely you have helped us get prepared to tackle COVID, and you've helped us get prepared to prepare for the worst and to hope for the best. So with that, I
Exactly.
thank you for the session, Dr. Sandhya.
Thank you. Thank you very much for having me, and namaste to everybody.